And we'll be nation leading with our mandate, which strikes at midnight tonight, when everyone is expected in a hospital in the state of New York or a healthcare facility to have been vaccinated. I will be signing an executive order to give me the emergency powers necessary to address the shortages where they occur. And that's going to allow me to deploy the National Guard, who are medically trained, deploy people who've been retired, who may have had a license lapse, bring in people from elsewhere. That is not my first position, though, my friends. My desire is to have the people who've been out there continue to work in their jobs, work in them safely. And
so that was New York's new governor, Kathy Hotchul, signing in a new executive order giving her the authority to apparently replace healthcare workers who she will in turn fire with National Guard members. All right, so let's just be straight up with this. The National Guard right now in New York is acting as scabs now for the government, right? They're going to get rid of all these people who aren't complying properly and instead bring on these people from National Guard to cover over them, right? Which of course does not at all help with the crisis of not having enough doctors and nurses, because unless this is going to be a permanent fix, this does nothing. This does nothing but prolong the problem over a larger course of time, as well as, of course, there's, of course, the question of how many of the National Guard members have the same training that these nurses have for this particular atmosphere when it comes to healthcare work, right? Of course, she says these are people who have either some level of knowledge when it comes to the healthcare field, but I'll be honest, I'm going to probably trust a nurse who's been in that particular hospital more than someone who got brought in at last minute, whose main job isn't even to help the public, but, in that sense at least, right? Don't get me wrong, National Guard does a lot of great things. National Guard's fantastic. It's so good that actually each state has their own, National Guards. I mean, the system for, creating the National Guards it's a great system, all right? It works out fantastically when it comes to many, many disaster relief scenarios. But this time, again, they're using them now as scabs. They're actually using the National Guard members as scabs to cover for the fact that they're now pushing out nurses and doctors. They mostly are hating the nurses because if they hit the doctors, well, those doctors aren't they the experts? Aren't they the experts? Well, if they're not taking the vax, maybe that says something. I don't know. But they're mostly, of course, talking about nurses, saying that, of course, we're going to fire all these nurses who are anti-vax. Now, I'm not sure about you, but anti-vax doesn't even mean anything anymore, right? I mean, I am 100% pro-vaccine. I know people who are against these kind of mandates who got the COVID vaccine, who thinks other people should get the COVID vaccine, but just thinks that the government shouldn't mandate it. Right? Anti-vax means you're against any vaccination at all, which I am not. I am pro basically almost every vaccine there is, and frankly, including COVID for the most part, right? Again, I didn't particularly get it because my doctor recommended against it. But I know a lot of people who got the vaccine whose doctor told them to get it, and hey, good for them. Fantastic. I think that's awesome that we do have a vaccine. Obviously, there's some questions about how well it really helps, but I think it's still good that we've created something, right? Something is sometimes better than nothing, right? It depends on what that something is, of course. But in this case, I think the COVID vaccine is a fantastic thing. But it doesn't mean it should be mandated for every single person out there. And again, they're just skirting over the fact that nurses and doctors, these are the experts. These are the people who've been dealing with this disease from day one. If they don't want to take the vaccine, for one, if they were going to get sick, I think they would have already got sick. I'm just going to say that. I'm pretty sure at this point they have probably some natural immunity. More than likely, that's probably why they're not getting it. The doctor who told me not to get mine simply told me it was because I already had COVID, so he didn't see a need for me to undergo any sort of other medical treatment if I already had the antibodies. He said it didn't make sense. He would never recommend it for anyone. That was my doctor. For all I know, he's full of S. I have no idea. Maybe there's a better doctor out there who would say something different. I don't know, but this was my doctor and I trusted him. For all we know, these doctors who are refusing the vaccine mandates are just people who've already had COVID and simply do not think they should go undergo any other additional medical treatment because they already have the antibodies. We have no idea. We have no idea. The governor here, Kathy, I think it's Hotchul, she has no idea. Do you think she's talked to every single one of these people who have not got vaccinated to see what their individual situations are? Many of them might not be able to even get the vaccine because of pre-existing conditions. We don't know. That's the problem with these kind of mandates. It treats everyone the same. It treats everyone as this group collective. I always talk about this idea that the leftists look at everything as a collective, right? It leaves no room for individuality. It leaves no room for, again, individual circumstances. For all we know, these doctors already have either a pre-existing condition or have already had COVID. We have no idea. Yet they're now going to be fired for not getting a vaccination and replaced with the National Guard. The National Guard who should be here helping people instead. Mind you, okay, real quick. Mind you, New York turned away the military medical ship they sent to New York prior. They turned that ship away because they said they didn't need it. They didn't, they had no need of it. Yet all of a sudden now they need the National Guard. This is just like the government. You create a situation, you create the problem. And I'm not going to say the government created COVID, though, there's some things coming out, I guess, about China and what happened over there. We won't discuss that right now. But I'm not going to blame the government for COVID. I'm not going to play the game where I'm going to sit there and blame every single person for, oh no, here's what you could have done earlier on or whatever. We had no idea what this was going to be. We just didn't. I'm not going to blame Trump for it. I'm not going to blame even so much the left for COVID itself. But what I am going to blame them for is their terrible policies that have sent us down this road. So the government creates a problem. The government says we're going to fire all these healthcare workers. Oh no, now we're going to be low in healthcare workers. Well, the only solution now is more government. The only solution now is bringing in more government resources through the National Guard. They create the problem and they come in and save you from that problem, or save you from the problem. In the end, it's typically going to be a worse service than what it was prior to the problem that government created in the first place. The government right now is creating this issue in the healthcare field, making it so obviously people are going to be fired. There's going to be shortages everywhere, and the only person or the only entity that people will be able to turn to, of course, will be the government at the end of the day. This is nothing more than, again, that slow attempt. The left has always been wanting to take control of the healthcare system. They always have. Of course, it doesn't typically end well. Of course, Canada had to reopen private insurers as well as private medical facilities because there were so many human rights complaints against them because of how terrible their public option really was. Can it work maybe in some places? Possibly. I mean, maybe. But this shouldn't be decided through an executive order. This should be decided amongst the people. The people, of course, each individual state making that decision for their state. If a state wants to have a public, option, by all means, that's their right to choose that. I would vote against it, but that's their right to choose that. But of course, these Democrat governors, these Democrat politicians, they do not care about what the public thinks. They just go through an executive action. That's what they've always done. That's what they always will keep doing because at the end of the day, the ends justify the means. This, I'm telling you, this right here is simply another step for them to take more control of the healthcare system, saying, well, see, the private sector can't handle it. Of course, ignoring the fact that they created the problem and made it so the private sector can't handle it. Right? I mean, let's face it, the biggest problems we have in healthcare currently all have to do with government intervention in the first place. I'd go on a long list of things that can be changed, right? And it's all basically around the insurance, the way insurance is run in this country. Almost every bit of it, though, is controlled mostly through the government. The government creates the problem, and the government steps in offering itself as the solution. It's what they always done, always will do. And again, this is the National Guard acting now as scabs for fired healthcare workers for not going along with their edicts. Either way, I mean, just again, another reason to ignore New York, another reason to just leave that place as fast as you humanly possibly can, right? Just leave there as fast as you can. There is no sense in being in that state. I am not going back anytime soon. I used to enjoy New York. I've always said for a long time now that New York is actually one of the better cities that I have visited. I don't like cities, but I've always said, that New York is actually a really good city compared to places like Chicago, Detroit, Seattle. I actually really do like New York in the past, but now, no, not going to New York. Me and my wife, we're not going to New York anytime soon. We're not going to Broadway, not doing any of that crap until this sort of stuff stops. There's just no need for it, no need for anyone to head to that hellhole of a state. Either way, of course, what do you think? Leave a comment below. What's the deal with this? I mean, is Kathy Hotchul going to be a worse governor than before? I mean, what do you think? As well as, of course, if you enjoyed this video, Leave a like, always helps, as well as, of course, subscribe to the channel if you want to see more. Either way, thanks for watching, and we'll see you again real soon.